Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for the study purpose. Hope you make use of this. Thank you very much. My dear friends, as we know, we have been discussing about rickets. And in the last class, we have seen the nutritional rickets and non-nutritional rickets, which is also called as vitamin D independent rickets or vitamin D dependent rickets, which is also called as nutritional rickets or refractory or refractive or resistant rickets. And so this is one of the most common cause for the rickets. Maybe because of the nutritional rickets or refractory rickets, there may be the rickets. One more common cause for the ricket is not related to vitamin D, rather related to calcium deficiency. Now we know that calcium absorption is possible in the presence of the vitamin D. Now there may be such situations where vitamin D level is absolutely normal, but from the diet or some of the other causes, there is no enough calcium and phosphorus for the absorption. So that may also lead to the rickets. So today we will discuss that cause of rickets. As we know, calcium deficiency may also lead to rickets. Now calcium deficiency may be nutritional. Okay, the deficiency of the calcium is there because of the nutritional problem, because there is poor intake of calcium in the diet. This is usually seen in case of rickets of prematurity. Okay, rickets of prematurity. In premature children or in premature babies, you will have the rickets, which is because of nutritional rickets. That means nutritional calcium deficiency, which is very common in premature and also in low birth weight babies. Okay, and the reason why in the premature babies there will be problem related to calcium absorption is in the premature and low birth weight babies, we will also have the problems related to thyroid and as well as parathyroid gland. And we know the role of parathyroid gland in the absorption of the calcium. Okay, phosphorus and calcium absorption is wholly depends upon the parathyroid gland calcitonin hormone, the dynamic equilibrium between the blood and the bone, which is maintained by the calcitonin hormone secreted from the parathyroid gland that we know. Apart from that, low intake of the calcium may be also one of the causes. Suppose there is low intake of the calcium, less than 200 milligram per day. Per day, we need about 200 milligrams of calcium, and this usually occur in the weaning period. Now, the low intake of the calcium may be the cause of rickets because of calcium deficiency. And it has been estimated that this problem is quite common during the weaning period, when from the breast milk slowly, when we are in the transitory period of changing the diet pattern from the breast milk to the weaning food or complementary food. Contain this, if that particular weaning food or complementary food, it does not contain sufficient amount of the calcium, or sometimes if the child is having some milk allergy. Now if you take the cow's milk, it contains enough amount of the calcium, isn't it? But suppose if the child is having some milk allergy or some lactose intolerance, etc. problem, where child is not able to take the milk products, so that may also lead to the calcium deficiency, especially during the weaning period. Now calcium deficiency can be seen secondary to some of the problems. Okay, this is because of the diet. Sometimes the calcium deficiency can be also seen secondary to the malabsorption. For example, in case of celiac disease or A beta lipoproteinemia like conditions, where the calcium absorption is get affected, because in celiac disease the whole intestine is get damaged, the villi undergoes atrophy and absorption is affected, and that may lead to, although also along with the other essential components required to the body, they are get left unabsorbed. Along with that, calcium may be also left unabsorbed, and that may lead to the problem. Another secondary cause of rickets due to calcium deficiency start only after 6 months of the infancy, because after 6 months of the infancy, this particular calcium deficiency start. Otherwise, the enough amount of the calcium will be there in the baby's body, And after 6 months, usually when we stop the breast milk and all, and even in the breast milk also, good amount of the calcium is there. Vitamin D is absent, but good amount of the calcium is there. Although the amount or ratio between calcium and phosphorus is not so high as that of the cow's milk, it contains a good amount of the ratio, good amount of calcium. So up to 6 months of the life in the infantil period, this problem will not occur usually. We are not talking about vitamin D deficiency, only calcium. But after 6 months, when weaning period starts or complementary food begins, that time if it is not well managed, it may lead to calcium deficiency. So in the first 6 months, most common cause of ricket is vitamin D deficiency. After 6 months, we can think about calcium deficiency leading to rickets. Now, along with the calcium, one more thing is phosphorus deficiency. Now, phosphorus deficiency may also lead to rickets. How? It's very interesting. Now, calcium and phosphorus, as I told earlier, they are the very good friends. Okay, they are always present in the body in a very good ratio. Okay, so there should be a proper calcium phosphorus ratio in the body, that is 1.2 to 1. Okay, so phosphorus level when raised in the body, it binds with the calcium and decreases the free form of the calcium in the blood. Suppose you are taking excess amount of the calcium, excess amount of the phosphorus. Now this increased calcium, what it will do is it binds with the calcium and decrease the free form of the calcium present in the blood. Okay, so usually some amount of the calcium is present in the free blood, which is available for the tissues and all. But as phosphorus level is more in the body, the more amount of this phosphorus, excess phosphorus, will bind with the calcium, and in that way decrease the amount of the calcium, and it try to maintain that particular ratio. Now this can also cause the rickets of the prematurity. When this happens, this may lead to rickets of the prematurity. Phosphorus is also required for the bone mineralization, no doubt. But thing is that calcium and phosphorus should be there in the proper ratio. If the phosphorus is more, it itself will go to bind with the calcium and decreases amount. Therefore, a ratio of 1.2 is to 1 that should be maintained. Okay, so phosphorus deficiency. This is if the proper phosphorus is more, but if the phosphorus deficiency is there, okay, so phosphorus is the first thing actually which is responsible for the beginning of the mineralization. As I told in the first class, I think there will be proliferative necrotic layer is there. The cartilaginous cells, they undergo necrosis, and that will be get filled up by the phosphorus. And once the phosphorus comes and lay down there, then the calcium deposition start. If the phosphorus is not laying down there, the calcium deposition will not start. Mineralization will be get badly affected. So even for the bone mineralization also, phosphorus is very, very important. Now phosphorus deficiency can also occur because of secondary malabsorption, just like in case of calcium. Like celiac disease may be the cause, cystic fibrosis may be the cause, A beta lipoproteinemia, cholestasis may be the cause, long-term use of the aluminum containing salt like antacids may be also the cause for the phosphorus deficiency. Now there is one more thing, is that is phosphate wasting disease. Phosphate deficiency can also seen in case of phosphate wasting disease. So what do you mean by phosphate wasting disease? In this case, there will be increased level of the phosphotonin. In this case, there will be increased level of the phosphotonin, which decrease the renal tubular reabsorption of the phosphate, So decreased phosphate in the blood and increased phosphate in the urine lead into hypophosphatemia rickets. Now this is very important. Phosphate wasting disease means there will be increased level of the phosphotonin, and because of this phosphotonin, what happens? Decreases renal tubular reabsorption of the phosphate. Okay, so from the urine, the phosphate reabsorption is minimized or decreased. So decreased phosphate in the blood and increased phosphate in the urine lead into hypophosphatemia rickets. Okay, so hypophosphatemia in the blood, the phosphate level is decreased. So one is fibroblast growth factor 23. Growth factor 23 is one of the well characterized phosphotonin. So what we are talking, there will be increased level of the phosphotonin in the urine. Okay, so one of such phosphotonin is fibroblast growth factor 23. Now because of this, there will be increased phosphate in the urine, leading to hypophosphatemia rickets. So this is also one of the cause for the phosphorus deficiency. One more important thing is hypophosphatemia rickets, a hereditary cause also. Hypophosphatemia rickets can occur. Now hypophosphatemia rickets is one of the X-linked hypophosphatemia condition, autosomal dominant type. One of the important example for dominant disease is hypophosphatemia rickets. Okay, whenever somebody asks what is an example for dominant trait, okay, so autosomal dominant hypophosphatemia rickets, male and female are equally affected, okay, because it is autosomal dominant. Now hereditary hypophosphatemic rickets with hypercalciuria. So these are all some of the conditions where there is hypophosphatemia rickets. The phosphorus amount in the blood is less, in the urine it is increased excretion because of the phosphotonin which is present. So these are the three conditions. X-linked hypophosphatemia rickets may be there, autosomal dominant hypophosphatemia rickets may be there, or hereditary hypophosphatemic rickets with the hypercalciuria may be there. Okay, so details of this X-linked hypophosphatemia rickets and then other things, renal tubular acidosis, etc. So that we will see in the next class. Thank you very much.